Welcome to Ask the Experts, North Texas. Thank you so much for staying with us on News Radio 1080 KRLD. I'm David Rankin.
And I'm Kristen Diaz. And today we have Dr. Amit Singal, who is joining us with UT Southwestern to talk more about liver cancer. Apparently, Texas and DFW as a whole both have higher rates of liver cancer than the rest of the U.S. So he's here to speak a little bit more about that. And is there one particular reason as to why this is?
Yeah, Kristen, David, first, I want to thank you for having me on the show today. This is particularly something of marked interest because we know that Texas has one of the highest rates of new cases as well as deaths from liver cancer in the entire country. And, there's been a lot of reasons why we think this may be true, but probably the leading sort of hypothesis is that this is related to the high rates of obesity and diabetes that we see here in Texas. As you know, Texas is one of the most obese states in the entire United States, unfortunately. And this really is probably what's driving this sort of burden of liver cancer here.
Is this also connected to the fact that Texas has some of the lowest rates of health insurance? So people are not necessarily going to their doctors for preventative care.
Yeah, David, it's a great point. So when we think of liver cancer burden, it's not equally spread across the populations. So we know that there are notable disparities in terms of who is impacted by liver cancer. We see higher rates among racial ethnic minorities, and we see higher rates among socioeconomically disadvantaged populations. Once again, to your point, I think there's lots of reasons for this. There's lower rates of sort of engagement with healthcare systems, lower preventive care. You see higher rates of obesity, poor sort of nutrition in those populations. And so there's probably a lot of different things that we need to act upon if we want to make a difference in the future.
The National Cancer Institute, they've specifically selected UT Southwestern to lead an effort in testing and advance new ways to detect liver cancer. What's new in that field?
Yeah, so Kristen, I think one of the reasons why this is really a major push is because liver cancer is one of those cancers where we've seen few advances in terms of mortality. The 5-year survival for liver cancer is dismal. It's basically your 5-year survival is less than 20%. So, it really is a cancer that we need to do better. And part of the reason why the survival is so poor is because many patients are found at late stages. And so what this sort of new effort is really trying to do is find better ways to predict who will develop liver cancer and better blood tests where we can find people at an early stage. And if we can do those things, we can actually then deliver curative surgical therapies and thereby dramatically improve survival for liver cancer.
You talk about the fact that obesity is very high and very prevalent in Texas, in the minority communities as well. Would losing weight, becoming more fit, does that then reduce your risk for something like this?
Yeah, so there's some simple things that all of us can probably do. So the first is that one of the major drivers here in the United States is viral hepatitis. So hepatitis B, hepatitis C. And we know that hepatitis C actually can be found in about 1% to 2% of the US population. And so it's now recommended that every American get tested for hepatitis C. And if they're found to have hepatitis C, they should get treated. The other things that we can do, like to your point, is, reduce alcohol. So alcohol is a strong risk factor for developing liver disease and liver cancer and obesity. So, it's the old school diet and exercise. So get out there, get some exercise and then start eating healthy. And by sort of changing those habits, we can significantly reduce the risk of liver disease and most notably liver cancer.
I wanted to touch on what you just mentioned about Americans getting tested. I was just recently, as of this morning, I think, reading an article about how Americans that were born in the 1950s, 1960s should get their blood tested to check for hepatitis C. Is that something that's new or something that's always been recommended and now it's just getting more of a spotlight?
Yeah, so this idea of if you were born in that baby boomer generation, this 1945 to 1965, was the initial recommendation for hepatitis C testing because that was the cohort that was really at highest risk. But what we've now seen over time is as we've had testing increase in that group, the risk is actually now evenly distributed among all adults. And so now the US Preventative Services Task Force and the CDC both recommend testing for hepatitis C in all adults. So it's not just these baby boomers, but sort of anyone over the age of 21.
At what point in someone's treatment does it come to the point where you may have to be talking transplants?
Yeah, so, David, transplant is one of the curative therapies that we have for liver cancer, particularly if somebody has underlying sort of liver disease and liver dysfunction. But it's really reserved for those people who are found at an early stage. So unfortunately, a small minority of patients with liver cancer are eligible for liver transplantation. And that's why one of the main sort of pushes for our sort of now new center is to help advance new biomarkers, new screening modalities, so we can find people on an early stage and once again, increase the proportion of patients who can undergo these curative surgical therapies.
Yeah, let's talk about that real quick. The UT Southwestern has this new clinical validation center. It's been funded through a 5-year grant through the Detection Research Network. How big of a deal is it that we have that here in North Texas?
Yeah, so there have been clinical validation centers for biomarkers and other cancers, such as lung cancer, breast cancer, ovarian, colon cancer, but this is the first clinical validation center for these biomarkers in liver cancer. And I think it's fitting that it's here in Texas. Once again, going to the fact that Texas is really disproportionately impacted by liver cancer. And so I think it's fitting that the solutions for this problem will happen here in the state of Texas.
You mentioned the fact that other cancers have had these biomarkers available for them for a while. Why is liver cancer being acknowledged so late?
Historically, liver cancer was a less common cancer here in the United States compared to Asia and Africa, where the rates were much higher. But we've seen dramatic changes in terms of the epidemiology, the number of cases that we've seen here in the United States. As we've had dramatic improvements in most cancers, decreasing number of new cases, decreasing mortality because of many of these advances, liver cancer is one of the few where the mortality, the death rate is actually increasing. And so there's been more and more of a push for us to do better. And that's why I think we're now starting to see more and more money and more attention being paid to address this before it becomes truly that problematic.
We've talked about racial disparities here with this type of cancer. Are men or women more likely to get liver cancer?
Yeah, so this is a cancer that disproportionately impacts men compared to women. This is probably related to a host of different reasons. Some, related to hormonal differences between men and women, predisposing men, and then of course, men, and I can say this as a man, we probably do worse things in life. I mean, so we more obese, we drink more, we have all those bad habits that predispose to liver disease and liver cancer. And so once again, a cancer that disproportionately impacts men.
You talk about the fact that this is a cancer that is fatal if it's not treated early. How much does early detection save lives?
Yeah, I think it goes back to that Ben Franklin quote, right? An ounce of prevention is worth a pound of cure. And so really, early detection is one of the best prevention mechanisms that we can do. So then we can really reduce the mortality. We've seen dramatic improvements in treatments for later stage cancers, but it doesn't touch what we can do if you find this early. And so this has to be one of the big pushes that we need in this cancer to make a difference.
Dr. Amit Singal, thank you so much for your time. Was there anything else you think our listeners need to know about this topic?
Kristen, David, once again, I'd like to thank you for having me here. I think, this is really a cancer that you will hear more about. If you know anyone who is at risk for this, has underlying liver disease, I would ask them to make sure they get into care so we make sure that once again, they can get screened and we can find this early.
Absolutely.